A shortage of doctors, nurses, and medical equipment is making the Ebola outbreak in West Africa difficult to contain.
Today, the United Nations Secretary General urged the international community to step up and help out. Ban Ki-moon says a coordinated global response is essential. He appointed the UN's public health expert to work on that effort. More than 1,000 people have died in the Ebola outbreak in just the last few months. The victims are primarily in Liberia, Nigeria, and Sierra Leone. Meanwhile, in the Twin Cities, a pediatric nurse at St. Paul's Children's Hospital is packing her bags and heading to Sierra Leone next week.
She's part of a group taking a large collection of medical supplies and protective gear to a hospital that desperately needs it. About 1/3 of the people who have died from Ebola are from Sierra Leone. And Angela Davis spoke with that nurse this morning before she started her shift, and Angela joins us now.
Yeah, admirable. She's going right in the middle of it. A woman named Carrie Jo Kane works in the emergency room at St. Paul's Children's Hospital. Her parents were missionaries and moved her and her brothers to Sierra Leone when she was just 6 months old. Now, Carrie grew up there but returned to Minnesota to go to college. Now she's going back, taking her medical expertise, her knowledge of several languages, and her compassion to help fight the Ebola outbreak. She has years of experience dealing with crisis and emergencies. She knows what it means to be needed.
And when I kind of stand back and look, I think, wow, you know, God has directed my paths for this time in this place. And I have to trust in that, and that He has control of this.
A few days from now, Carrie Jo Kane will be working in a hospital in a rural area of Sierra Leone, teaching community health workers how to treat patients while at the same time protecting themselves from the deadly disease.
I can take the education and knowledge, I can take supplies from here, I can cross completely into that culture. I have so many contacts and friends and established within the healthcare system there in legitimate ways to fit in and impact and make a difference there.
She says the biggest problem is the lack of protective gloves, masks, goggles, and gowns to keep the Ebola virus from spreading from patient to caregiver.
You're dealing with buckets of water. How do you wash your hands after every patient? There's not enough gloves for every patient interaction. There's not enough gowns and protective equipment. They're the ones I'm worried about. They're the ones on the front line.
She showed us photos from her childhood years in Sierra Leone with her family and her friends, with whom she's still in frequent contact. She believes she will be safe.
So we're going to take precautions. If we have interaction with sick patients, we're going to protect ourselves.
Now, Carrie Jo says the need for protective gear for doctors and nurses, as well as medical supplies and medicine, is huge. The conditions inside hospitals are so bad that many nurses and doctors there have stopped going to work, she says, out of fear. If you would like to help in the effort to send those needed supplies to West Africa, you can go to WCCO.com/links. You'll find information on the organizations that Carrie Jo is working with as she travels there. And Amelia, I should mention her plane ticket there was about $4,000, which she's paying for herself. Because this is so
wonderful she's doing that. Yeah, and I understand that she is going back again after this trip.
Yeah, she says she'll be accepting a job there as the head of nursing at a hospital, and she's going to be moving to Sierra Leone with her husband and her 7-year-old daughter in January, and she'll be there for a few years teaching and training.
Wow. Yeah. All right. Thank you.